You are welcome to the International Herbal Centre, London. Please remember to subscribe to our channel. Our topic this week is 8 ways to fight kidney diseases. The kidneys are vital organs responsible for several essential functions in the human body. This includes filtration. The primary function of the kidney is to filter, remove waste products, toxins, and excess substances from the blood to form urine. The kidneys play a crucial role maintaining the body's fluid balance. The kidney are crucial in removing various waste products and drugs from the bloodstream, aiding in the body's detoxification process. For you to be alive, you must have at least one kidney that is functioning. Kidneys are prone to diseases if not well maintained. There are various things we must do to keep it functioning well. In one of the survey in United Kingdom, the National Health Service of England reveals a survey of more than 1.8 million people diagnosed of having chronic kidney diseases, CKD. In addition, there are 1 million people who have the condition but are undiagnosed. CKD can substantially reduce quality of life and leads to premature death for thousands of people each year. People with chronic kidney disease, CKD, have a gradual loss of kidney function over time. A majority of people with CDK suffer complete kidney failure and require renal replacement therapy, RRT, dialysis or transplant. People with CKD are also at increased risk of stroke, heart attack, bone diseases and other conditions. Chronic kidney disease can be prevented if adequate preventive measures are observed by individuals. Such preventive measures includes the following. 1. Avoid high cholesterol level. High cholesterol levels can potentially damage the kidneys. Cholesterol is a type of lipid, fat, that is essential for various bodily functions. However, having elevated levels of cholesterol, particularly low-density lipoprotein, LDL, cholesterol, often referred to as bad cholesterol, can lead to the formation of fatty deposits in blood vessels. These deposits can accumulate in the small blood vessels of the kidneys, impairing blood flow and causing damage to the delicate structures responsible for filtering waste products from the blood. When the kidney's filtering units, glomeruli, are damaged, it can lead to a condition called glomerulosclerosis, where the glomeruli become scarred and less efficient at filtering waste and excess fluids. As a result, kidney function can be compromised, leading to chronic kidney disease, CKD. To avoid high cholesterol levels, you can take several proactive steps and make lifestyle changes that promote heart health. Here are some recommendations. Focus on consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, such as fish, poultry, and legumes, and healthy fats, such as avocados, nuts, and olive oil. Limit your intake of saturated fats, trans fats, and dietary cholesterol found in red meat, full-fat dairy products, processed foods, and fried foods. 2. AVIOD. Regular dehydration. Dehydration can potentially damage the kidneys. The kidneys play a crucial role in maintaining the body's fluid balance and filtering waste products and toxins from the blood to form urine. When you become dehydrated, your body doesn't have enough water to carry out its normal functions, and this can impact the kidneys in several ways. Reduced blood flow to the kidneys. Dehydration leads to a decrease in blood volume and blood pressure. As a result, there is reduced blood flow to the kidneys. The kidneys rely on adequate blood flow to effectively filter waste products and maintain electrolyte balance. Drink plenty of water. The most straightforward and effective way to prevent dehydration is to drink an adequate amount of water throughout the day. Aim to drink at least 8 8-ounce glasses of water per day, though individual needs may vary based on factors such as age, activity level, and climate. 3. Ensure to use low salt. High level of salt, sodium intake can potentially damage the kidneys. The kidneys play a crucial role in maintaining the body's electrolyte balance, including sodium and potassium levels. When you consume too much salt, it can lead to several adverse effects on kidney function. Increased blood pressure. Excess sodium in the bloodstream can lead to increased water retention, which raises blood volume and ultimately increases blood pressure. High blood pressure, hypertension, is a significant risk factor for kidney damage and chronic kidney disease, CKD. If you are already experiencing kidney damage or have a condition that puts you at risk for kidney problems, taking steps to reduce salt intake and manage the underlying condition can help protect your kidneys. Here are some measures you can take. Limit salt intake. Reduce the amount of salt in your diet to help lower blood pressure and reduce the strain on your kidneys. Aim to consume no more than 2,300 mg (mg) of sodium per day, or even less if advised by your healthcare provider. Read food labels. Be vigilant about checking food labels for sodium content, especially in packaged and processed foods. Choose low sodium or sodium-free alternatives whenever possible. 5. Avoid high sugar and glucose level. High sugar and glucose levels can potentially damage the kidneys, especially in the context of diabetes. Diabetes is a chronic condition characterized by elevated blood sugar levels, either due to inadequate insulin production, type 1 diabetes, or insulin resistance, type 2 diabetes. Prolonged high blood sugar levels can lead to several complications, including kidney damage. Here's how it happens. Diabetic nephropathy. Over time, high blood sugar levels can damage the small blood vessels, glomeruli, in the kidneys, impairing their ability to filter waste and excess fluids from the blood. This condition is known as diabetic nephropathy or diabetic kidney disease. To avoid high sugar and glucose levels, especially if you are at risk of diabetes or have diabetes, you can make several lifestyle changes and adopt healthier habits. 6. Be careful with painkillers. Some painkillers, especially when used excessively or for prolonged periods, can potentially damage the kidneys. Non-steroidal anti-inflammatory drugs, NSAIDs, and certain other pain medications are known to have the potential to cause kidney damage. Here's how it can happen. Reduced blood flow to the kidneys. NSAIDs work by blocking an enzyme called cyclooxygenase, COX, which reduces inflammation, pain, and fever. However, they can also affect the production of prostaglandins, which play a role in maintaining normal blood flow to the kidneys. When prostaglandin levels decrease due to NSAID use, blood flow to the kidneys may decrease, potentially causing kidney damage. Minimize the risk of painkillers damaging the kidneys. You can take several precautions and adopt alternative pain management strategies. Here are some steps to consider. Use painkillers only when necessary. Avoid taking painkillers for minor aches and pains that can be managed with rest, ice, or other non-medication methods. Reserve painkillers for more severe or persistent pain when other approaches are not effective. Follow recommended dosages. 7. Eat health diet. Unhealthy diet can damage the kidneys and contribute to the development of kidney disease. The kidneys play a vital role in filtering waste products and excess fluids from the blood, maintaining electrolyte balance, and regulating blood pressure. An unhealthy diet can put extra strain on the kidneys and lead to various kidney-related problems. Here's how an unhealthy diet can damage the kidneys. High sodium intake. Consuming too much sodium, found in table salt and processed foods, can increase blood pressure and strain the blood vessels in the kidneys, potentially leading to kidney damage over time. 8. Ensure to exercise regularly. Regular exercise can have positive effects on kidney health. Engaging in regular physical activity offers several benefits that can support kidney function and reduce the risk of kidney-related problems. Improved blood pressure control. Regular exercise can help lower high blood pressure, which is one of the leading risk factors for kidney damage. By reducing blood pressure, exercise decreases the strain on the blood vessels in the kidneys and promotes better kidney function. Please remember to subscribe to our channel.